Years ago, in terms of incarceration, most of the offenders were over 30 years old. Now we're seeing a lot younger kids coming in. In Massachusetts, the age of majority is 17, so 17, 18, 19. Those numbers are trending up dramatically. And it's not alcohol, it's heroin, it's OxyContin, it's those type of drugs. In terms of substance abuse problems, 80% of the inmates, upon sentence, self-report they have a substance abuse problem. In terms of arrest, that can be a little bit deceiving. Property arrest, assault and batteries, larcenies, breaking and entering, those type of arrests sometimes hide the fact that they're really drug-related. Property violations are the highest percentage in terms of arrests that we have in the Dedham jail, but that's because it's really these folks with addictions who are looking for money. They're breaking into the houses for money or for drugs. We are heavily programmed oriented, which means substance abuse. We take a holistic approach, AA meetings, psychological services, mental health issues. There's a growing and burgeoning population coming into this facility with mental health issues because of the lack of resources outside, in the outside community, and there's probably less programs because of budget cuts, et cetera. Well, if those issues aren't dealt with, something as simple as the right dosage of medication, they could end up here because of nuisance crimes they commit on the street, which is not uncommon. Then we have to kind of straighten them out in terms of what their dosage is, the proper level of psychological care. Also, what we find is when these young offenders come in, or any offender come in, the greatest contributing factors to why they are here has to do with education, cognitive behavior, anger management, substance abuse, obviously, psychological issues. Those are the factors we assess immediately. And then we have a panel of the folks that specialize in those different areas in the jail, and they decide which programs that we are going to connect the inmate to.